Hi everyone. I would like to go over anatomic landmarks noted on this setup series. Why don't we start out with this upper right quadrant? Do you see this kind of U-shaped radio-opaque border? So that's the zygomatic process of the maxilla. And you also you can notice that there's a thick, again, border that extends from the inferior border of the zygomatic process of maxilla extending posteriorly. So that's actually the inferior border of the zygoma. And immediately below that, you see this thin corrugated outline proximally here, and part of this may also go over that as well. That represents the floor of the maxillary sinus. Let's look here as well. So here's the floor of the maxillary sinus, and we have a cone cut. What's interesting here is, although this is not anatomic landmark necessarily, tooth number, let's see, it looks like number 5, has sustained a roof fracture, horizontal roof fracture. You can see that there is a radiolucent line extending from one side of the tooth all the way to the other side, and there's a little bit of widened PDL space. This could represent early periodontal disease and bone loss. Yeah, so let's go back to this one. This is a canine periapical radiograph, and up above we see this border, which is the nasal aperture. Nasal aperture, and if you can call this floor of the nasal cavity, that's acceptable. This wide zone of radiolucency, it's hard, it's a diffuse area of radiolucency, is consistent with the lateral fossa. And if you look at this one, again, this is the nasal aperture. There's a nasal aperture. Presumably where they come together will form an anterior nasal spine. Additionally, we see this kind of soft tissue radiopacity extending all the way down, and that is a soft tissue of the nose. But just the way it's shaped, it's so elongated, and I'm not really seeing the LR of the nose, so this most likely represents I think it's called columella of the nose. And although it's difficult to determine the exact border, this radiolucency in between the two central incisors is the nasal palatine foramen. And you can sort of see this thin radiolucent line. I think it's best visualized here, which should be continuous all the way to here. That's the intermaxillary suture. Again, soft tissue of the nose. You can see part of the nasal aperture here and here. Here's the intermaxillary suture, and again the nasal aperture. This is where I would expect the floor of the maxillary sinuses. It's, I think, hard to tell because there's a lot of superimposition, but at least here we can see the border of the maxillary sinus. Oh, let's see. Did we? Okay, so we didn't have that one, so it jumped to bite wing radiograph. Here's the kind of anterior border of the ramus, and this opaque border is the external oblique ridge. And the alveolar crest, of course, and the other side. Okay, so just the alveolar crest. Now we're looking at the area of lower right quadrant. This kind of a relatively thick, dense border represents the internal oblique ridge, and that typically defines the superior border of the submandibular gland fossa. So any area below that internal oblique ridge would be consistent with submandibular gland fossa, and then they generally appear very radiolucent. From here, from this radiograph, I think it's very difficult to determine either internal oblique ridge nor the mandibular canal calcification or mandibular canal corrugation. Right about here toward the edge of the film, we see that there's a genial tubercle with the lingual canal or lingual foramen that's centered within the genial tubercle. And from this particular projection, I think it's very difficult to determine that this is a genial tubercle. Okay. Let's see. So on this particular radiograph, I think it's hard to say again some of the anatomic structures. So let's go to the next one. Okay, so we know external oblique ridge typically extends obliquely, something like this, close to the level of the CJ of the second or third molar. So that's the overall direction and outline of the external oblique ridge. And if you look below, you can see that there's a relatively well-defined trabecular pattern in the upper half of the image, whereas anything below this opaque line, it's very radiolucent for the most part, right? So there's a clear distinction between above and below this line. So this line is the internal oblique ridge, which again, based on my Comim CT experience, this is typically the superior border of the submandibular gland fossa. So that's internal oblique ridge, also known as mylohyoid line. Here's the submandibular gland fossa, and in this area you can see a very thinly corrugated outline that's relatively straight, and that's the mandibular canal corrugation. As far as whether this is superior inferior corrugation, I don't know for certain that in order to determine that we may have to have a Comim CT, but I want to say, if I had to guess, this is most likely an inferior corrugation, and then the superior corrugation of the mandibular canal may be superimposed with the internal oblique ridge, so that it's hard to see which ones where the exact position of the mandibular canal corrugation is. But we can kind of see the overall direction of this radiolucent channel, right? So here it is, superior and inferior. Okay, that's it for me on this setup series, and I'll try to go over one or two more set of CMS so that you can be better prepared for questions regarding anatomic anatomy. Thank you very much, and I'll see you in the next video.